As you all probably know already, I'm Teri Thorson with Spinal Cord Injury BC, and we also have Jenna again today helping us out. Also like to thank our sponsor of these sessions, the Craig H. Neilsen Foundation. And as I say at every meeting we have, we are working with Dr. Krasiakoff to identify people with spinal cord injury that are in need of the PPE supplies. And I'll get Jenna to write in the chat her email address again. And if you identify as someone who is in need of these services or supplies, please send her an email. And this session is going to be an hour long. Dr. Hallam will be doing a short presentation, and then we'll get to the pre-submitted questions and then the live questions from the audience. Today we are very grateful to have as our special guest expert, Dr. Brad Hallam, who's a registered psychologist with Vancouver Coastal Health. He works out of the GF Strong Rehabilitation Center. So Dr. Hallam, thank you so much for being here with us today, and I will hand it over to you to take away, please.
Thank you so much. Feels like having lunch with about 16 people. This is great. So thanks for joining. I think I'll be admitting people. I think I'm the host now, so you might hear some ding dongs, but I'll let people in as we go. I'm gonna see if I can share my screen. I prepared just a short presentation. I don't want to fill up the whole time with some kind of academic talk. I really just wanted to share a few ideas, and then I've also gotten some questions ahead of time, which I've actually tried to incorporate into the presentation. But obviously, you know, we can also just go free form, and people can unmute, and we can ask questions as well. So let me see if I can share this. Hold on a second. Great. So I'm going to be talking a little bit about mental health during COVID. I think there's a ton of information that's out there in regards to infection control and physical health, but I don't think there's been enough emphasis on this topic. So I'm really grateful to be able to speak to this. Special thanks to SCIBC. I'm a huge fan of the work that they do. They have a little corner office here at GF Strong, so I get the opportunity to see Teri and Ryan quite a bit, and mainly on inpatients, but I also do a bit of outpatient work as well, and they're a huge resource. No conflicts to declare, which basically means I'm not going to try and sell you anything, and if I point you to any books or websites, I'm not getting any kickbacks or anything like that. So that's what I'm saying there. COVID-19, I think we've all kind of had a couple moments like this in terms of how we're feeling. You know, when we think about COVID-19, we lump it in the general term as natural disaster, and we think about people's psychological reactions to things like Hurricane Katrina, the earthquake in New Zealand, and or SARS, and we kind of lump it in as a natural disaster. And I found this slide interesting because I think it shows what the natural trajectory of a psychological reaction is in a natural disaster. And usually, you know, if you think about with COVID-19, we kind of have these warning signs. We saw some things that were happening in Asia. People started to get concerned that it was going to reach us, and then boom, the impact, it hits North America in early March. And initially, there's kind of this heroic response where people are kind of, you know, acting on adrenaline and pulling together. And there's all of this, you know, let's flatten the curve kind of language that happens. And, you know, and then with BC in particular, you know, we did really well in regards to flattening that curve. And so kind of have this honeymoon of celebrating, and there's, you know, this feeling of community of, you know, we're doing this. And then there's the drop. And I think that's probably where we are now emotionally is kind of the stage of disillusionment of, okay, so, you know, we've done okay. And I thought what was going to happen is we were going to flatten that curve and then life was going to get back to normal, but it's really not feeling like that. last week I bumped into 3 different colleagues at work here who were quite emotional and in tears. And I think the reality that things are not just going back to normal is starting to hit people, right? It's like we're kind of adjusting to a new normal. Healthcare is not throwing their doors open. Things are happening very slowly. Your lives are opening up slowly. And really until there's a vaccine and people feel more comfortable, that we're going to be living our lives a bit differently for the foreseeable future. And I think a lot of people are kind of here, right? We're kind of struggling with that disillusionment phase. So I just point that out just to kind of give it a bit of normalcy for people. If you're feeling disillusioned, you're probably not alone. So there was an article that came out just about a month ago that said, you know, what is the psychological impact of quarantine in particular? And, you know, keeping in mind that people are going to react very differently to quarantine, depending on their age and their context. My son is 8. He's living his best life right now. He's out of school. He's always got a parent around. So in many ways for him, the quarantine impact has been minimal. But that can be quite different depending on your personality type and what you're dealing with. You know, if you're reliant on caregivers and you're canceling those caregivers because you're concerned about infection, and then suddenly that's a huge stressor. You're told to socially distance, but you're going down the street in a wheelchair and you can't get away from people or keep that 2 meters apart. These are huge stressors, obviously, and I recognize that that's probably the context for many of you. I point this out just to say that these numbers are super high. We're looking at, you know, about 73% of people reporting low mood and about 57% irritability. Irritability is often kind of synonymous with low mood and anxiety, right? So these things have high prevalence during quarantine. Doesn't mean everybody has that experience. There's 17% here who are not reporting low mood, and there's a little bit more than half who aren't reporting irritability. But just to kind of point out that these are much higher than base rates we would normally see. And the longer the quarantine, the more symptoms that get reported. So the article goes on to say, well, how do you reduce it? One of them is to keep quarantine as short as possible, which seems kind of logical, right? But I guess that's a question that I would encourage everyone to ask is, are you balancing your quarantine behavior with quarantine risk? Depending on your injury, depending on the kinds of medical conditions you have, extreme quarantine might be warranted, and it might be recommended by a physician. Others of you might be kind of feeling anxious about going out, and your quarantine behavior may not actually be matching your risk. I can't really answer that question for you. That's more a discussion to have with a physician. But I think that would be question number one, is to ask. If you're staying inside because you're anxious, that's very different than a calculated decision that this is the right choice for my health condition. The other one is give people as much information as possible. So I would encourage you to think about how much time you're spending reading the news and where you're getting your news. And that might seem logical, but I think it's really easy in quarantine to just turn on your phone or whatever, flip through the news, and you can kind of get inundated with news story after news story after news story. And that is not really great for psychological well-being. You start to only see the world through a very, very narrow lens. And it's important to consider how much and the sources. Adequate supplies. I thought it was fantastic that Teri led off with this. It was kind of a question of, you know, who needs support? And it's those questions of when people have adequate supplies for infection control and daily living, they obviously cope better. Reduce boredom and increase communication. So how do you do that? Well, this is one of those venues for increasing communication and staying connected. I know the SCIBC has gotten creative as well with some online forums and things like that. And then there's kind of some special attention to healthcare workers who have higher rates of anxiety because of fear of infection. And then finally, that people have better outcomes when they self-regulate their quarantine behaviors versus it being mandated by the government. Article goes on to say that there's evidence to suggest that support groups for people who are quarantined can be helpful. And it was, I just put this here because I think that's a lot of what SCIBC is trying to do, is have forums like this that help validate. So the very fact that we're doing that, that's in line with mental wellness and the evidence. So I just wanted to point that out. So APA comes out with this statement as well. You'll find this on their website, that disasters are especially tough on people with disabilities as well. So people who tend to struggle more with disasters are people who with pre-existing mental conditions, and then people who are struggling with disability as well. And that probably makes very, very good intuitive sense. But I think it's in this article that we were just looking at, disability was not mentioned. And so I just wanted to make sure that we were thinking about that in the conversation, because that seems like an obvious thing to be talking about. I'm going to jump to some of your questions, and I'm just going to dive in. I didn't get all of them typed in, but I tried to draw on the ones that I thought would be generalizable to most people. So is it normal to be nervous about reconnecting with the outside world? And the answer is yes. If you've been quarantined and you're spending most of your time inside and you're starting to think about getting out there, it can be very anxiety provoking. And the strongest antidote to nervousness is exposure. So it's doing it. And it's the whole saying of just getting back on the horse and doing things. I think when you get out there, probably what you're imagining in your mind when you're in quarantine creates a lot of anxiety. And then when you get out there, you realize that what you're imagining, it doesn't always line up. So you might go out and see, oh, wow, that person is going for a walk, or this person's doing that, or they're, and when you have that exposure, it kind of helps bring the anxiety down. If your anxiety is really high, start with something small and build from there. And that can be as simple as just getting out your front door for 5 minutes and getting some fresh air, and then 10 minutes the next day and building on that. It doesn't mean that your very first day you got to get out and hit the store, because that's a whole nother level. So how does anxiety affect pain, health, and well-being? So the first thing I'll say is life without anxiety is not a realistic goal. And particularly during a pandemic, it's also not a realistic goal. Of course, we want to try and minimize anxiety, but I don't want to set the bar as 0 for anyone, because I just don't think that's realistic. If you think about anxiety, it's almost like an amplifier. If you're playing a guitar, anxiety is what makes all of those signals much more intense. So if you're feeling pain, low mood and anxiety can amplify those kinds of symptoms. Anxiety also releases cortisol into the bloodstream, and people will, it kind of alerts the body to be on guard and to scan for danger, and it also reduces immune function. When people are feeling quite stressed, it's quite interesting, because I could show you a picture right now of people at a Canucks game. And about 3 months ago, you would have had these like amazing feelings of like, you know, yay, community, and everyone's at a sporting event. And if I showed it to you now, a lot of people would kind of be like, oh, kind of like, I can't believe people are sitting that close together. And it's the exact same picture, but we have such a different framework. And right now, our minds are scanning for infection, and they're scanning for danger. And that's kind of how we've been reprogrammed over the last couple months. So it's good to just be aware that that's what our brain is doing, and to take a deep breath, to kind of slow it down, and to remind ourselves that we're not only looking for danger. We have to be smart, obviously, but that we also start to notice other things that are going on in our world. I find myself unmotivated for working in self-care. Do you have suggestions on keeping motivated, working from home, those kinds of things? So once again, I keep coming back to this theme of trying to normalize things and not overly pathologize things. Everybody is struggling with this right now. The thing I would remind people is that motivation and behavior are bidirectional. I think it's a real trap to think that you'll start doing these things when you feel them. What often happens is if you do them anyway, the motivation will follow. If you get yourself up, if you get dressed, those kinds of things, then often motivation will follow after that. The analogy here is artists, and there's probably some artists in the group here. If you waited for every inspirational moment to sit down and do your artwork, probably wouldn't be very productive. A big part of being an artist is the discipline of sitting down, and then often in the midst of that discipline, that's when the creative juices will start flowing. It really is important to stick to a regular routine, including showering and dressing professionally. Even if you're not going into the office, if you're working, trying to maintain that. I know that's complicated by some of you if you're reliant on caregivers and they're not coming into your home right now. But to the extent that you can stick to a routine, that's helpful. Zoom is a great way to connect, but Zoom fatigue is real. And it's good to mention. Yesterday I was on Zoom for 5 hours doing meetings, and by the end I was just exhausted. So keep that in mind. It is good to connect in this way, but there's something about the experience of having to concentrate and function in the two-dimensional world rather than the three-dimensional world that is tiring. I get frustrated at people not respecting my boundaries. How can I communicate them to express my discomfort without coming across as angry or paranoid? I think anyone who's had a spinal cord injury has dealt with this issue, right? Having to educate people who don't understand spinal cord injury about the kinds of things you're dealing with. And so I think it will be an ongoing challenge because people won't understand your unique circumstances. And so there is a need, unfortunately, to educate, repeat, educate, repeat. And the level of disclosure that you do is really based on level of trust. If it's someone that you really trust, you may be giving them a lot more information about the kinds of diagnoses you have or specific struggles you have. But if it's someone that you don't know well, you don't have to give them a lot of information. You just have to be able to kind of draw the line. I think it's always important to have a script ready ahead of time, as opposed to being in that moment when you're feeling anxious or feeling angry to kind of find the right words. And so I would encourage people to think about writing out that script. What could you say in a way that would be assertive, but not aggressive? And being able to say, I need you to not come in the door. I need you to leave that there because I've got a health condition and I don't need any more exposure. But whatever it is, something that would be logical, reasonable, assertive, and that you can write out when you've got a clear head and you're not kind of in that moment of trying to fumble with it. Just gonna check the time. Okay. So what are some tips for staying mentally well during COVID? Well, it kind of depends. So if you were struggling before COVID, it's important to reach out for more formal supports right now. And I don't know each of your backgrounds, but family physicians are often a starting point. They often don't know the more detailed resources that are out there, but they can be a good starting point just to make sure they're aware of what you're struggling with. If any of you are on medications for mood or sleep or anxiety, this might be a time for your family physician to take a look at those, maybe up doses if needed. If you have a mental health clinician that's already known to you, please reach out. There is an online therapy program for people in Vancouver. Originally, this was supposed to be only Vancouver, but I think they're opening up their mandate to all of British Columbia, and it's run out of Vancouver Coastal Health, and it's basically email therapy. So you send an email, and you're like, this is what I'm dealing with, and then they respond back with a response, and it kind of goes back and forth like that. That can be a nice way to access therapy where you don't have to leave your home and you don't have to be reliant on Zoom. The BCPA came out with what they call psychological first aid. I'm sorry I don't have the link there, but if you go to their website, you can talk with a psychologist for free. The idea there is that they are trying to help people who are struggling right now. It's not ongoing therapy. It's like a one-time half-hour conversation. They're trying to point you to resources and give you what they think you need, but they're not trying to be your therapist. It's more kind of like, if you think about applying first aid for a physical injury, that's what they're trying to do on the mental health side. And then if you go to the BC Psychological Association, there's a referral page there where you can sort and find a psychologist. You can enter your location, language, whether there's a specific issue you want to talk about, and it will match you to psychologists that are in your area. If you were coping reasonably well before COVID, then I would recommend trying some self-directed kinds of therapies. And there have been three major waves in psychotherapy. First was behavioral, second was cognitive behavioral, and then third is what we call third wave psychotherapies, which is acceptance and commitment therapy. So the second wave, I've got a reference here, called the Antidepressant Skills Workbook. You can go to this. It's based at SFU. You can listen to it in audio format. You can read it on the screen, or you can download it as a PDF. It's also in several languages. It's based on cognitive behavioral therapy, and it's got a ton of evidence behind it. And that's kind of a self-directed approach. Acceptance and commitment therapy is kind of the third wave. It's more in line with more Buddhist kind of thinking in regards to, rather than jumping in and trying to change my thinking and change my behavior, just not struggling and allowing myself to feel a little bit anxious and tolerating that and not feeling like I have to fix it. And there's a lot of great resources here. I was going to show some videos from that, but Teri was advising me that sometimes it gets real choppy in this format. But if you go to this website, there are a bunch of free resources, which include small videos and chapters to read that'll introduce you to that approach. Okay, I'm going to shut up and let you ask some questions.
I have a few more questions that came in sort of at the last minute.
Sure.
Let's see. How come sometimes I feel completely fine about COVID and then sometimes I start to panic thinking I might end up getting it?
Yeah, sure. This is where I lean a little bit on my cognitive behavioral therapy background, because I think there's a very, very tight link between what we're thinking and what we're feeling, and that there's a very tight connection. So, sometimes COVID's not our focus as we're going on. We're just living our lives. And during those moments, I think we can often feel quite relaxed. But then when we start to dwell on something and kind of go over it in our minds over and over and start to dwell on the risk, that's where then our anxiety can start to ratchet up, right? So I think a lot of it is, if you start to pay attention to what it is that you're thinking and what you tell yourself, you'll probably see a very tight correlation between what's going on with your mood and your anxiety. If that's kind of your experience, then some of the cognitive behavioral therapy resources that I pointed out might actually be a good fit for you.
Great, thank you. Okay, next one. Being on quarantine for 3 months is playing on my mental health. Mornings are okay. Afternoon, not so good. What can I do to feel good all day? I think you pointed out some tips there, but maybe we'll just summarize them in that.
Yeah. This is where this stuff's hard, because if I was sitting across from you, whoever asked that question, I'd probably ask you a series of questions in regards to what's happening between morning and afternoon. But I'm not going to do that. I'm just going to kind of pull back and answer the question bigger picture. The acceptance and commitment therapy stuff I was talking about, one of the premises of it is the happiness trap. This idea that I have to monitor myself, and that my sign of mental well-being is that I'm happy, and that I don't have any stress. And this framework actually argues that that's not a great metric of mental well-being, that our emotions throughout the day will vary, and that's okay. And particularly during quarantine, when we don't have contact with other people, maybe we don't have access to the leisure activities we've been doing. Rather than beating ourselves up about not being happy all the time, is to just accept the fact that we're in a tough spot. And some of it is just not entering into the struggle of, I've got to feel better, I've got to feel better, I've got to feel better, and just kind of letting it go and just being like, this is tough. I'm going to do my best today to commit to the things that I think are going to make me feel okay. But to not get caught up in feeling like that's the metric of mental well-being.
Mm-hmm. Thank you. So there's a question, it's not necessarily related to COVID, but I think probably a lot of people during this time, this person experiences fatigue with bad weather. But I think a lot of people can relate to maybe fatigue, and what you can do about that, avoiding any kind of type of medication. And then on the other hand, what if you can't sleep? So I think there's two sleeping sort of questions there.
Yeah, big topics. I feel like this is probably the logical place to talk about pot and alcohol and things like that. All over social media, you'll see the jokes about how stadiums are going to be filled with people, for AA after coming out of quarantine. And I think a lot of people are using substances right now as a way of coping. There's pros and cons to that. I joke that it's kind of the shortcut to happiness for a lot of people, right? I think moderation is one thing if you don't have a history of dependence. But the thing with substances is sometimes it can leave you feeling fatigued, and the problem hasn't gone away, right? And so that's the challenge, right? So yeah, you might get an hour or two of, kind of checking out for a bit and getting a break, but do you end up with the backlash of that? So that's one thing I think when we're thinking about fatigue, is to immediately bring into the conversation, right? Is to monitor your substance use, because that can contribute to that fatigue cycle. That's one thing. I know that sleep is super complicated. There's so many variables with sleep, right? It can be bed positioning, it can be pain, it can be anxiety, it can be people getting off their sleep schedule during quarantine, right? It's really easy to get off your sleep schedule. If there's a book I could recommend on this, it's called, oh gosh, what's it called? The author's name is Colleen Carney. It's Carney. It's called Goodnight Mind. And if you were in my office and you were talking about sleep difficulties, I would go through that book with you. And we would just kind of go through and look at all of the variables that are impacting your sleep. When people have sleep difficulties, the most important thing to do is to get back on your regular sleep routine, and eliminate naps during the day. That's like a number one priority. And sometimes if your sleep schedule's really off, you have to do that in like hour increments until you get yourself back on track. Sleep is so important to mood. When I have clients who are here on inpatients and they come to my office and they're crying, one of the first things I say is, "Are you sleeping?" Because that has a huge impact on mood, and that's usually where I first start problem solving with people. Sometimes when you get sleep resolved, a lot of the mood stuff just takes care of itself. It doesn't take a PhD to kind of figure that out. So special attention to sleep, I think, is really important. And if you're struggling with it, I think that book is a great resource.
And you mentioned this in your presentation, but just in case there's any others that you can think of, for those who can't afford to pay us for a psychologist, are there ways to access no-cost therapy?
Yeah, I can't even afford to pay a psychologist. It's pretty ridiculous. So I would say, Kelty's Key, if you can access it, is a really great option. It's a way of accessing psychotherapy that's free. It's based on cognitive behavioral therapy principles, and it's going to be delivered by a registered psychologist. So that's a really fantastic resource if you can access that. I would say don't hesitate to reach out to psychologists and explain your situation. A lot of psychologists have a sliding scale fee, and they reserve a couple spots for people who have low income or who are struggling. And you might be surprised. Like on their website, it might be published as $200 an hour, but they might be able to say, hey, I've got a spot that I save for people, and it's $50 an hour. The other thing I would say too is that there's good evidence behind self-directed cognitive behavioral therapy for people who typically cope pretty well but are just struggling right now. And so some of those online resources that I recommended, give a shot. There's a lot of bang for buck in regards to self-directed therapies.
Thank you. And I can take them out of the presentation and send anyone who's interested that list of resources. Just please send me an email. I'll just type my email address in there as well. And the last question is, if we were to get hospitalized, what is the best way to be able to deal with sort of our own vulnerabilities, dealing with SCI medications, advocacy for ourselves, with clinicians and staff?
And the kind of the idea is you're getting hospitalized for COVID?
Or maybe not even COVID. Maybe it's, this question is particular for COVID, but if we were hospitalized for any reason, I guess, during this time.
Yeah, sure. Two things. One is people who do the best in hospital with spinal cord injury have an advocate. And I hate to say it, but it's true. Having somebody who can be assertive and voice your needs when you're sick and not feeling well is hugely important to outcome. And we see this time and time again where, let's say we have somebody here at GF Strong who has to be sent over to VGH. And those nurses don't know to turn the person, right? So that they're not getting SORS. Unless somebody's speaking up, it might not happen, right? And then you could come out of an acute unit not getting the specific specialized spinal cord care that you need. So having an advocate, number one. Those of you who have spinal cord injuries, which I'm assuming 99% of you on this call do, have probably had to learn some assertiveness skills along the way, dealing with healthcare professionals. You earn your stripes, unfortunately, with having to assert yourself and talk about what your needs are. There is nothing wrong with being a broken record in the healthcare system and repeating yourself and advocating for yourself and asserting yourself. So if that's something that's uncomfortable for you, like I said, having a little bit of a script ahead of time is helpful so that you know what to repeat when you're in that situation. Those are just some things off the top of my head, but I ain't gonna lie, that's a tough situation to be in if you're gonna be hospitalized and not feeling well.
Mm-hmm. Yeah, thank you. That is the last question that I have. So if anyone wants to sort of do a little raise the hand, or you could just type in me in the chat box if you can't find the raise the hand, if you have anything to ask on your own.
Christina's got a question in the chat function. Do you see that?
Yep. You can go ahead and read it off there, Brad.
Yeah, so it says, Christina's asking, how careful do we have to be now that everything is starting to open up? Yeah, it's a good question. It's a complicated answer. I think you had a conversation with someone from infectious disease, right, Teri? That kind of. Yeah. Okay. So I'm not going to pretend to be an expert in those things, but I guess what I would say is, based on what I've been hearing, is right now there's not a ton of community spread. That most of the infections have been identified in specific areas like long-term care facilities and different segments. With that said, if you are very, very high risk, you might need to be more careful than someone who is lower risk and has fewer medical complications. So I really feel like it's an important conversation for someone to have with a physician who knows them well. But I would check in with yourself after that conversation with a physician. And if you are, there's a difference between quarantining for infection risk and agoraphobia. So being stuck at home and being afraid to leave the home, right? And if it's more you're afraid to leave the home, it might be time to start challenging yourself a little bit to get out there a little bit more. And when you do that, when you start to expose yourself to the thing that you're afraid of, it's not as scary. And you start to realize, okay, it wasn't as bad as I thought. And then you build on those successes.
I actually have a little bit of a question. You do a little bit of outpatient therapy. Could we get referred to you?
Yeah, so here's the thing. I thought that, and a lot of people thought that we would, we'd flatten the curve and we would be, back to business as normal. At GS Strong right now, the outpatient programs we're only allowing about 10% of patients into the building. And so the only people that are coming into the center are going to be clients who are like urgent and are at risk of decompensating if they don't get services. Having said that, we're also trying to do hybrid of me doing sessions like this with people so that people don't have to come into the center. And if you wanted to access me, you have to be registered with the spinal cord injury outpatient program. And to do that, you would have to, some of you may already be, I don't know. But if you're not, then the logical step would be you'd have to have your family physician make a referral into GS Strong for that.
Oh, yes. I don't have a computer, but I would like to know if the SFU workbook was available as a paper, a real book. So that's one question. And also, I don't see what you see. So people who are watching, I'd like to know the website for the video on the Buddhist. You mentioned the Buddhist. So there's a video or something.
Yeah, and I know when you call into a Zoom call, obviously you're not able to see my slides. So I'd be happy to provide the slides to Jenna or Teri, and they could pass them on if that would be helpful. I was just trying to understand your first question. It was about a book.
You mentioned a cognitive antidepressant. You mentioned an SFU has a workbook you can get by PDF download, but is there a real one I can touch. I need an actual book.
Yeah, this
workbook.
one. Yeah, this one. I'm trying to think if I've ever seen it. I don't think I've ever really seen it as a real book. If you're looking for a book that's kind of based on the same principles and one that you could find very quickly on something like Amazon, there's something called Mind Over Mood, and it's cognitive behavioral therapy, and it's the exact same principles. So if getting a book is important to you, that would be a good one.
Okay, and how do you, if I have somebody else do it, how do you download the SFU workbook?
So when you get my slides, you'll see a link that's there.
When I get your what?
The slides from the talk. So I can have Jenna or Teri share the things that I was sharing with everybody on Zoom today.
Okay,
so you
good.
can actually
Thank you.
see it. Yeah, and there's a link there, and when you go there, it'll give you really clear steps about how to access it.
Okay, thanks. Thank
Is
you.
it a large workbook, Brad?
No, it's quite small.
Okay. I wonder if we print your slides, we could also print that PDF and send it all to Mary.
Yeah, for sure, and it's public domain, so you don't have to worry about copyrights or anything like that.
Okay.
Thank you. Great, thanks.
Thanks, Mary.
I might as well, while people are maybe typing stuff in, and to keep the flow of conversation going, I know one thing we sort of didn't really touch on is mindfulness. And do you want to talk a little bit about that and maybe how that could help us during this time? Yeah,
sure. I mean, mindfulness has become so trendy. I think it's even on the iPhone now. And what's ironic is I think the original intent of meditation with mindfulness was not to solve anything. It was just with the Eastern tradition of being mindful. But I think the Western world kind of latched onto this as, hey, we could, reduce depression and reduce anxiety. And there is truth in that. I think mindfulness sits really, really well, particularly with the acceptance and commitment therapy. And the idea behind the acceptance and commitment therapy is that we have all kinds of thoughts that come into our mind, and they're just thoughts, right? It doesn't mean that they're necessarily reality. And mindfulness and acceptance and commitment therapy kind of go hand in hand, because you have to be able to be still and to be able to recognize that you don't, with every thought that comes into your mind, you don't put a hook on it, right? It's okay to recognize that as, that's just a thought. I'm feeling anxious right now. I had an anxious thought. And I'm not going to wrestle with it. I'm not going to put my hooks in that and perseverate on it and think about it all day long. It's going to be directing my attention back and being mindful to whatever it is that I'm doing and not cascade down in my thoughts. The classic analogy here is you can have lunch and never even taste what you're eating because your mind is somewhere else, right? Mindfulness is just simply being present with whatever is in front of you and whatever you're doing. And there's a lot of power in that and a lot of life satisfaction with that. They've done research studies looking at people who practice mindfulness while they're cleaning toilets as compared to somebody who's not being mindful, who's doing what would be perceived as an enjoyable task. And rates of satisfaction are with the people in the camp cleaning the toilet. And it's kind of that idea that even if what you're doing is unpleasant, that when your mind is calm and you're open and you're present with what it is that you're doing, that the natural benefit is that the central nervous system the autonomic nervous system just kind of calms down.
Yeah, thanks. And if I can maybe share like a little real life experience and maybe some tips of how you deal with this, because I haven't personally, as I'm sure most of us, left my house in 3 months. And I ended up, you know, because I've heard that stores and things are doing really well at, you know, social distancing and making areas. So I went to London Drugs a couple weeks back, and it was not good. Well, in my opinion, I felt very uncomfortable, and people were really close to me, and I just wanted to get out of there. So I started feeling a bit panicked, and I still have to like make it home, and now I'm touching all these things and my wheels. So when you're kind of in that moment, what are ways that we could sort of bring ourselves back and not doomsday everything?
I really appreciate you bringing up an example like that because, you know, I think the advice I was giving that if you get out there, it's not going to be as bad as you had imagined. And it sounds like in your experience, Teri, that it was kind of scary, right? Yeah. And I also think that that's good grist for the mill in terms of kind of evaluating what you need to do. So I guess the thing I would say first of all is that you do have to be smart. And if you feel like you're in situations where people aren't respecting the 2-meter distance, if you're feeling uncomfortable, that may not be a bad thing. Anxiety is there sometimes to alert you to the fact that something's wrong and that there is a danger. And that's why I don't ever subscribe that we should try and get rid of anxiety 100%. Anxiety serves a function, right? Where anxiety becomes problematic is where what's going on in your world or your mind is just not matching reality, right? So I guess that's my first point is if you are in a situation that doesn't feel safe to you and doesn't seem to be in compliance with what you know the rules are, then listen to that anxiety and leave that situation. And I wouldn't encourage anyone to just plunge themselves into that. And that's okay. So the fact that you have a panic response in that situation, you know, I don't know what you're telling yourself. You could have been catastrophizing it, you know, and like, oh my gosh, I'm going to be intubated tonight, or, you know, something like that. And I think that's where we have to be careful with our thoughts because, you know, what's the evidence, right? If we go back to that, I think community spread is still quite low, right? And so would that be upsetting? Of course. Should I not go back to that store again? Probably, yeah, right? If that's the way they're doing their business. But am I panicking and exaggerating things and making the risk bigger in my mind? That's when it's good to check your thoughts and be like, okay, yeah, that was uncomfortable, but I'm going to do, you know, my hand sanitizing and do those kinds of things, clean the wheels as best I can, those kinds of things, right? I don't know if that helps, but yeah.
Thanks.
Thank you. My question goes back to a comment you made earlier about having information and how important it is to have information, and actually relates to some of the other comments that you've made recently. But the health authority has made a decision not to release information as to, you know, they'll give us numbers of the number of cases of COVID and, you know, the number of deaths, but they won't say where they are within the province of BC. And I find that there's been situations where, you know, I want to know where my gas gauge is in my location. Am I too anxious? Am I over focusing on this? Am I hypervigilant to a greater degree than I should be? And I'm just wondering what your opinion is about sharing that kind of information, why they decided not to share that information, and would it be better if they did share that information?
That's interesting because the information that I get is actually broken down by health authority, and I can see how many patients we have in hospital, how many are in ICU, how many deaths there's been. So I'm actually able to see it by region. I wonder if the difference is because I'm a hospital employee. I don't know. So what are you looking at? Where are you getting that information?
I was looking for information as to where the cases are coming from, and I couldn't find that. I didn't know if it was available by health region, but I live on the island.
Yeah.
And so, you know, when you see new cases, it raises your anxiety level. But when you see that those cases are somewhere else, then your anxiety level doesn't need to raise. You need to be vigilant. You need to be careful and prepared, but you don't need to, you know, have your meter go to the top every time you hear of a new case. At the same time, you know, you don't want to have somebody say, okay, well, there's no cases in Saltaire, so I can be free as a bird and going crazy. But yeah, I don't know if that's generally available to the public, the information that you have.
Yeah. And I think it's also, like you're talking about, the contextual information is important too, right? Like you could have, you know, 10 new cases in, let's say, Victoria, but if they're confined to a long-term care facility, then that might inform your thinking differently as well, right? So I get it. I don't have a quick answer for you because I'm actually very in line with exactly what you're saying, is that information is power, and information is also helpful in terms of checking your thinking and making sure that you're being realistic. I guess I wasn't aware that you weren't able to access that information. I know that the Ministry of Health has a website. I usually go to the coastal one. I haven't been to that one. So I'm not really sure if it's breaking it down or not. So I don't have a good answer for you. Yeah.
Okay, thank you.
We do have, Patty mentioned on the chat, this website that you can access for your particular postal code. Maybe, Scott, it might be helpful. It's called flatten.ca. Like flatten the curve, but just flatten.ca.
Excellent, thank you.
Marnie has asked if she posted a link from the government of BC that has a map from the BC CDC site, and she's asking if it's any good.
I haven't looked at that one. I'm tempted to link on it, but I probably shouldn't do that in the middle of the talk. But I'd like to think if it's coming from the BC government, it would be reliable. But I haven't actually looked at it yet.
Well, I think if that's all the questions that we have, last call out for questions. All right. I think we're good. Thank you, everybody, for all your chat and suggestions in there. That is great. Dr. Hallam, thank you so much for this information. I guess you'll send me the slides and I can forward it over to anyone who would like to see those links. So
yeah, my pleasure. Hey, you know what? Thank you so much for inviting me. I have a real heart for what you do. So I appreciate being included.
Yeah, no, we appreciate you spending your afternoon with us. So thank you so much. It was really great.
My pleasure.
All right. Take care, everybody. Thank you.
Thank you.